I'm going to speak about health, and what I'd like to let you know is that Kevin Rudd has delivered on his commitment to stop the blame game. With the health and hospital reform, these are the biggest changes we've ever had to the health and hospital system since the introduction of Medicare. Now, Treasury has estimated that without change, state health spending will consume the entire state revenue of the governments over the next 3 decades. Now, the Rudd government has committed $64 billion for health and hospital funding over the next 5 years. The National Health and Hospital Network will be nationally funded, but most importantly, it will be locally run. So you've got to ask yourself the question, what does this exactly mean? Well, what it does mean is that $950 million has been allocated to increase the capacity of emergency departments throughout Australia to improve services and waiting times. In aged care, the government is investing $300 million in zero real interest loans to help build an additional 2,500 aged care places in areas of high need. $36.8 million over the next 4 years to set up one-stop shops for easy access to aged care services. And a further $103.1 million to develop a better trained aged care workforce. For doctors and nurses, the government has committed $639 million to train doctors and will also invest a further $128.4 million to increase the retention and training of our nurses. For health infrastructure, the Rudd government will invest $355.2 million to 23 new GP super clinics and upgrade 425 general practices. Now, I'm already on the public record saying that I will fight for one of the 23 GP super clinics to be established in the Macarthur region. For mental health, the Rudd government will also invest a further $79 million over 4 years to deliver up to 30 new headspace services. I'm very passionate about mental health because it affects my family. For dental health care, the federal government has also delivered on its teen dental plan, providing $150 for eligible teenagers to gain checkups. But unfortunately, the government's changes have been blocked by the Liberals in the Senate. As a result of the Liberals, young Australians have been denied the opportunity to receive these benefits of the new dental health program. So what does this all mean for Macarthur? Well, it means Camden Hospital will not be closing. It means that more money will be flowing to Campbelltown and Camden's hospitals. I'm already on the public record stating that I will fight to reopen Camden's maternity ward, which was opened by a Labor government, but couldn't find enough doctors and nurses because of Mr Abbott's ripping $1 billion out of the health system and capping GP training places despite massive shortages. Okay. Labor's revolutionary changes will improve the long-term sustainability of growing health expenditures by establishing one national network, nationally funded but run locally. I will fight for Macarthur's fair share of these benefits.
The Liberal Party strongly believes in reforming the health system, in particular our public hospitals, and we support measures which will provide better outcomes for patients. Under Rudd's $3.2 billion health and hospital funding, not 1 cent comes to the people of Macarthur. Here it is, 32 projects, not 1 cent to the people of Macarthur, $3.2 billion. All we have seen is millions of dollars of our money spent on ad campaigns, promising health reform in the lead up to an election. All talk, no action. Just another election strategy for the next federal and state elections. At the last election, Rudd said the Commonwealth would take sole control of the health system and fix hospitals by mid-2009. Hello, it's 2010. Has anything changed? No, just another one of Rudd's broken promises like the great moral and economic challenge of our time, the ETS, and the many other broken promises. All he has changed is a funding agreement between the states, travelling through new layers of bureaucracy before reaching patients. Nothing has changed. The states are still in control. Who is Kevin Rudd kidding? We will not see any health reform until 2014, another 2 elections away. He is treating ordinary Australians and the people of Macarthur with disdain. It's politics first and patients second. Rudd's health are all spin and hype. Have a look at Labor's political stunt when they opened the Camden maternity ward in 2003 during the election and closed it immediately after. Will it happen again? If Labor had any concerns for health in the Macarthur region, why would they approve a gas-fired power station in Campbelltown, affecting the air quality and impacting upon 2,500 children who pass through Campbelltown Hospital suffering from asthma attacks each year? Poor decision. Let's have a quick look at Labor's health achievements. Labor approved a polluting power station that will impact upon the health and welfare of our local residents. Of the supposed millions of dollars Labor have announced, none of it is actually coming to Macarthur out of 32 projects. There is a very real threat that Rudd and Labour will force the closure of Camden Hospital as healthcare becomes activity-based. At the last election, Labor promised to recruit 7,500 retired nurses, less than 1,000 returned. They have promised 36 GP super clinics, but have only delivered 2. At that rate, it will take 54 years to deliver on Labor's 2007 election promise. Compare this to our track record. Nick claims that Tony Abbott ripped $1 billion out of health. In reality, investment in health increased from 19 billion to 51 billion. And here is the proof. Another document that states what we've spent in the last years. We've funded a $42 million medical school at UWS in Macarthur, training doctors locally. We've improved access to medications available under PBS from 2.2 billion to 6.3 billion. We've increased funding for medical research and created 3,700 extra nursing places. Do you trust Labor? I don't.